It's a great pleasure to be here. I've really enjoyed the conference over the last 2 days. As Malcolm's already said, I'm going to talk a little bit about roaming access to Wi-Fi. And I really enjoyed Marcus's presentation earlier because we've been party to some of the same sort of discussions about the value of Wi-Fi. And Wi-Fi is something that in the research and education sector has become really the standard practice for access to resources. I'm going to be speaking about about various approaches to roaming in the NHS, but how one of the systems that we use in research and education potentially could be of value, is being of value for academics and students who come into the NHS, but could potentially be a resource for within the NHS as well. I work for JISC, or I work for Janet as well. Janet used to stand for the Joint Academic Network. It's the network that connects all the universities in the UK together, all FE colleges and skills agencies. JISC is the overarching organisation, so I'm going to say a bit about that. I'm going to talk about two aspects of roaming. One briefly about one way of roaming, of course, is to have free Wi-Fi access within a hospital or other NHS site. Then there's also this EduRoam approach, which I've mentioned, and then what might be possible within the health and social care arena. You can see here that JISC is it's actually a charity. It used to be a top-funded organisation by higher education funding councils. It's really a bit like HSCIC for research and education in the UK. And it has this vision and mission. I particularly like the bit about exploiting fully the possibilities of modern digital empowerment, content and connectivity. And that is what we're trying to do. So, as I already said, one solution to roaming in the NHS is to essentially just provide free patient and visitor Wi-Fi. An increasing number of trusts do offer this, and in fact, quite often it comes out of the patient experience initiative, where they want to be seen to be helping patients and visitors, and also encouraging sort of online feedback and use of social media to get feedback on services. As Marcus mentioned in his presentation, John Popham has a campaign for this and a Facebook group trying to make the case for hospitals particularly to provide free patient and visitor Wi-Fi. And of course, if it's for patients and visitors, that also includes, from my point of view, students or visiting academics, or could it even include visiting NHS staff. So it does offer some kind of generic solution, but in a way it is also a local solution, because usually, as Marcus also mentioned, you usually end up going to a registration page like you did today for the free Wi-Fi at the NEC. So it's not seamless, but it is a solution. And as mentioned earlier in Marcus's presentation, it is a growing phenomenon that hospitals are offering free patient and visitor Wi-Fi. A bit of work recently, about 75 different hospitals of various sizes do offer that now over a significant part of their site. And there are 12 others that are in limited areas in the site, quite often in the sort of either cancer or the services that involve children and adolescents. And then others, about 21, who do offer a Wi-Fi service, but you actually do have to pay for it. There is a list available on that link, just wasn't able to fit them all onto a slide. The Wi-Fi survey that Marcus did has been a fantastic resource to try and help with this, although as previously said, that now is focusing particularly on clinician access to Wi-Fi. And Chris Case's website about my hospital, we're essentially trying to capture the Wi-Fi provision at each individual site. And anyone can go on there and add a site. If you're visiting and you discover what's happening with Wi-Fi, you can add that in, or if you're from that site, you can just update it or add it in if it's not there. But in research and education, we there has been a sort of international solution developed for roaming, for use of Wi-Fi or even fixed connectivity, in fact. And this is EduRoam. And in the UK, JISC provide the EduRoam service, but EduRoam exists across 34 countries across Europe. It's very big in Australasia and growing in other continents as well. America have come slightly late to the party, but are implementing now quite rapidly. And this is what it is. It's a network connectivity solution. It's very strong on authentication, but it's a federated service. It doesn't actually provide Wi-Fi infrastructure. It is a way of accessing the Wi-Fi once that is in place. So saying someone's got EduRoam doesn't mean that that's the thing that has provided the Wi-Fi in the first place. It's a way of using the Wi-Fi to particularly support visitors. It's a federated service, so the organisations individually sign up to be part of the federation, and as part of that they sign up to, if they're wanting to be just a visited site, they have to provide the internet access to the visitors and the mechanism for managing the authentication back to the user's home organisation, which I can say a bit more about in a minute. It's all standards based. Quite a lot of it can be used open source solutions like FreeRadius, which is quite often part of the solution. Virtually all universities in the UK now run EduRoam extensively. It's a very popular service. An increasing number of further education colleges and other organisations are taking it up. And in terms of visited service, that's open to anybody. So things like leisure centres or museums, local authorities, through some of the smart city work, for instance, are implementing EduRoam. And as I've already said, it's available worldwide. And the real benefit of it is that it provides a free Wi-Fi for a user at a huge number of locations. It just happens. Once you've been set up, there's no registration page. You get clicked onto Wi-Fi. And there's huge savings in terms of guest access management. It encourages institution collaboration, and it also currently it is mostly provided in terms of basic internet connectivity, but there are different options because the visited site owns the security profile. There are different options to provide different security templates, so it potentially could be used for more secure requirements. But the way it mostly is used at the moment is that as a basic internet connection. If you want more security than that, you're using some sort of secure tunnel across it. But one of the big benefits is that the visitor, that someone that's coming onto your site, really remains the responsibility of their home organisation. So if there is a problem and they're doing something they shouldn't be doing, that issue goes back to the home organisation. And if there's troubleshooting, the home organisation is the one that should be sorting it out. There are already benefits of EduRoam to the NHS because it is become viewed as a very effective and well-liked solution for supporting internet access for clinical placement students in the NHS and clinical researchers and other academics. As you know, there are large numbers of students at any one time throughout the NHS. In the modern curriculum for medicine and nursing, a lot of time is spent in the NHS. This is a way of replicating the experience they have at the university in their NHS environment. And then all the generic benefits about visitor access management, all those things from the previous slide also accrue to the NHS. And that is why there are 95 hospitals in the UK who have enabled EduRoam on their Wi-Fi, on their NHS Wi-Fi. And again, there's a list which I couldn't fit on. There's 95 of those, and they vary in size, again, depending on how you implement it. But that goes, say, the Royal Cornwall Hospital in Truro, goes right up to Forester Hill at Aberdeen, and takes in Plymouth and Bristol, the whole size. He was in Bristol, the whole of the Oxfordshire NHS, large number of sites in London, Leicester, number around Manchester as a project at the moment to extend it across the whole of Yorkshire, but already Leeds Teaching Hospitals, for instance, and Sheffield Teaching Hospitals have it. Then lots around Glasgow and Dundee and Aberdeen, as I've already mentioned. So it is a widespread thing, and quite often it's mentioned in those meetings that the universities have with the NHS about how are they going to work together to enhance the student experience at an NHS trust. This is a topic that's quite often raised, and that's quite often where this comes from. Briefly, so then, how does it actually work, the Eduroam? It's in this sort of slide here, we've got a sort of academic example of the user has basically come from Camford University and their home organisation. They've turned up at a visited college. Both are members of the Eduroam Federation. The device that the user is using has automatically picked up there's Eduroam available, an Eduroam SSID. That has automatically kicked off an authentication process which goes through a secure tunnel to the national radius proxy that's run by JISC, and that sends down the request to the home organisation to say, is this one of your users? Do you recognise them? Is it okay to proceed? They link it to their identity management solution. Comes back, says yes, that's one of our users. Authentication message gets sent back to the visited organisation, and at that point the internet access is enabled, and that happens automatically. I happen to be at Derriford Hospital in Plymouth because I live there at a conference in their postgraduate medical education centre. I had my smartphone with me. I turned it on. I was connected to Eduroam. I didn't even know they had it at that point, and I was connected. So that's the way it works. It is quite important, I think, to separate out the two things. There's the authentication process back to the home organisation, which is a very small amount of data. It's just about making sure the authentication is right. But the internet access itself is provided by the visited organisation. But the way that it's been mostly implemented in the NHS to date is that it's mostly been done in those areas which are fairly and NHS trusts, particularly teaching hospitals, which are coterminous with a medical school. So there's quite often a nice big link between the two organisations with a firewall. And essentially what happens is the user turns up on the NHS Wi-Fi, and the authentication and the internet traffic both get transported directly back through to the university and out to the internet, to Janet, or where else it needs to go. So essentially, what that's doing is that the university's own Eduroam footprint has just been widened into the whole of that NHS Wi-Fi provision. And as I say, that's the majority of current use cases, implementations use that mechanism. There is a bit of a hybrid that's been used by a site which is more remote from a university. You're not going to have a direct link, but in the case of Weston-super-Mare and University of Bristol, Weston provide the internet access, but they didn't want to manage the authentication. So the authentication process was taken on by the University of Bristol on their behalf, and that part of the process can actually work through N3 out to Janet or the internet, and then back to the University of Bristol. That mechanism works, and it's been a very effective solution there in Weston. But probably the preferred mechanism would be for an NHS organisation to join Eduroam in their own right, particularly as a visited site. There's no fee involved in that, but they do. That NHS trust does need to have their own direct internet access, because unfortunately, the way that the N3 works, it just doesn't allow the DNS to work properly back into N3. So you do need your own internet connection. And Chelsea and Westminster Hospital are an example of someone who's done that, as is South London, Maudsley and St George's. And those latter two trusts are trying out being a home organisation as well, where potentially NHS users, where we're saying limited currently to research and education, people involved in research and education, they too could then become roaming, so that they could go to the university or anywhere where it's an Eduroam enabled and pick up access. There's a bit of a basically it's a bit of a issue about overall eduroam policy because, as has already been said, it's an international thing. There is a sort of council in Europe which controls policy on eduroam, and some countries are nervous about extending eduroam into other sectors, not on a visited basis, but on as a home organisation. And there are some legal issues in some countries which make it difficult for them to embrace that. In the UK, I think we would be quite keen to embrace it, but we do have this slight issue on the policy. But what we are looking at, and would be very interested to discuss with anybody who's interested, is essentially doing eduroam, but actually calling it something else and having it as a different federation. And when the Public Services Network has started to look at this with some pilots in Kent and Surrey, and in the N3 replacement of Scotland Wide Area Network in Scotland, they're also interested in trying to do something along these lines, and discussions going there. But I think we are looking to see whether we could somehow create a federation which could be a Meduroam or HSC roam or something else, which would allow the sort of roaming, with seamless roaming between NHS organisations and maybe NHS and social care organisations, where this sort of access could be provided. So if anybody is interested in that, you could get in touch with me and I will put it onto the right people who are having the sort of discussions that are going on with the Cabinet Office and others. And there is also potential maybe for 1 or 2 pilots that could be done on that. So that was what I was going to say. We are encouraged by the growth in eduroam. In fact, when I started to do a list of who had done it, I had 20 more different sites that came forward because it essentially is not that difficult to implement, and they just done it locally and it just worked and didn't have to tell anybody. Particularly around Glasgow, for instance, no one knew that Glasgow had done eduroam in all their partner organisations in the NHS, but in fact that is the case. Anyway, thank you very much indeed. We've got time for a few questions.